guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, I'm going to be doing another Kahoot, but I'm going to be covering pain. Before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead, give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There you can sign up for a next generation NCLEX review session, part 1 and part 2. In part 1, I teach you how to think critically. I teach you about priority. I teach you about delegation. I teach you about certain scenarios that NCLEX will put you in and where your mind is supposed to go, what they're expecting to see from you. I teach you how to think critically. In part 2, we actually go over NCLEX type questions, and most importantly, the rationales, what you need to know, what you need to understand. You can sign up for a private tutoring session with me. Maybe you want to pick my brain about something. If you're a current nursing student, you can get audio lessons. If you have to do really well on your next exam, be sure to check out my audio lesson and see if I have an audio lesson that matches whatever's going to be covered on your next exam. Almost daily, you can find me covering a variety of nursing topics across my social media platforms, such as TikTok, Instagram, Facebook, and right here on YouTube. My handle's the same everywhere, Nexus Nursing. Without any further ado, let's get started. Pain. First question. Which of the following should the nurse consider regarding gender differences in pain perception? Here are your options. Men are more likely to report higher levels of pain than women. Women typically have higher pain threshold than men. Women are more likely to express and report pain openly compared to men. Or gender does not influence pain perception or reporting. Which of the following, according to research, is true regarding gender differences in pain perception? Very good. Women are more likely to express and report pain openly compared to men. Research has shown that men are more likely to diminish their pain level, and they're more likely to report having control over the pain. Now, this is what's so interesting, guys. Even though women are more likely to report or express pain, they're more likely to from heart attacks. And you know, when you're having a heart attack, that is severe pain, right? That is severe pain that you feel like an elephant is on your chest. So they're more likely to report pain, but women are more likely to and have even if they don't, off the complications from the underlying what caused that pain are more worse than women. And studies have shown there's no exact cause that we can point to, but a lot of theories out there point to the fact that a lot of the pain that's being described or that they're diagnosed with is general, right? And so what happens is a woman that have pain and they'll think it's just, gas or, epigastric pain, and it was a heart attack and things like that. So that's men are more likely, even though they are not more likely to report pain, when they do report pain, that pain tends to be addressed more in men than women, if that makes sense. Okay. All right. Which statement indicates a need for further teaching about gender differences and pain perception? Women tend to have greater sensitivity to pain because of hormonal influences. Men typically seek medication treatment for pain later than women do. Both experience the same type of pain, so their perception is the same. Or cultural factors can influence how men and women express their pain. All right. The correct answer is both experience the same type of pain, so their perception is the same. Now, the question asked us which one requires further teaching. In other words, which one's wrong? Whenever a question asks you what requires further teaching, what requires follow-up, What requires clarification? What they're really asking you is which one is the wrong answer choice? And here, the wrong answer choice is to say that both men and women experience the same type of pain, therefore their perception is the same. That's not true. Why? Because lots of things can affect the perception of pain. Hormone, culture, right? Physiological factors, lots of things affect the perception of pain. Now, the other option choices are true. That's why we didn't choose that. Women tend to have greater sensitivity pain because of hormonal influences. True. Men typically seek medical treatment for pain later than women do. That's true. Cultural factors can influence how men and women express their pain. That also is true. And that's why we didn't choose those as correct answer choices, because we were looking for the wrong answer choice for this particular question. You would monitor the patient for which potential adverse effect of excessive acetaminophen use. We're talking about adverse effects. Would it be renal failure, hepatotoxicity, GI bleeding, respiratory depression? We're looking for adverse effect of excessive acetaminophen use. Thank you for all the hearts. I see them. Very good. Hepatotoxicity, liver damage. What is acetaminophen? What trade name are we talking about? What drug are we talking about when we say acetaminophen? Can you guys tell me on the live? Yes, Tylenol. Tylenol. Too much Tylenol can cause what? Liver to damage. And yes, renal failure, but eventually it's going to kill your liver a lot quicker than the kidneys. Yes, eventually it'll get your kidneys, but it'll get your liver first. Okay. Something important to know about acetaminophen. This is a non-salicylate. You see these other options: renal failure, GI bleeding, respiratory depression. We see that more in NSAIDs or opioids. Okay. So you do need to know acetaminophen. This is a non-opioid analgesic, and it is a non-salicylate. Non-salicylate, you need to know that. And you need to know that it affects the liver. Which statement by the patient indicates a need for further teaching about acetaminophen? I should not take more than 4,000 milligrams of acetaminophen in 24 hours. I should avoid chronic use and overdose. I should avoid drinking alcohol while taking acetaminophen. I can safely double my dose if I need more relief. Which one requires further teaching? Very good. I can safely double my dose if I need more relief. No. Guys, anything more than 3 grams in 24 hours, that can cause what? Hepatotoxicity. Serious damage to the liver. Okay. All of the other statements are correct. So that's why we didn't choose it. We were looking for a wrong answer choice. Which is the most important assessment to perform before administering morphine? Skin turgor, respiratory rate, bowel sounds, or urine output? Very good. What is morphine? It's a narcotic. It's a narcotic analgesic, right? It can cause respiratory depression. So you better take that patient's respiratory. No, that's not good English. Take the patient's respiratory. No, you should take the patient's respiratory rate. No, you should take the patient's respirations. There we go. I'm not an idiot. I promise you guys, I know what I'm talking about. Yeah, you better take that patient's respirations before you give morphine, because if you go to count that patient's respirations and their respirations are 12, are you going to give that morphine? No, you're going to withhold that medication and call the healthcare provider, right? Which statement about morphine indicates a need for further teaching? I should call my nurse if I feel very drowsy or have trouble breathing. I will take a laxative or stool softener using morphine. I can take an extra dose if my pain is not relieved within an hour. I may experience some nausea when I start taking morphine. Which one requires further teaching? Very good. I can take an extra dose if my pain is not relieved within an hour. Absolutely not. You have to take as ordered. This is a narcotic, right? It can cause respiratory um, depression. It can cause other issues in the patient. You have to teach a patient to take it as ordered. Everything else is right, because one of the things we're concerned about when it comes to narcotics, a safety issue. The patient may get dizzy. We don't want them to fall. That's why you tell them if they have to get up for any reason, they better press that call light. You're going to help them to get up. We don't want them to fall. If they have trouble breathing, um, narcotic agents such as morphine slows down the respirations. It could cause dizziness. It could cause confusion. It slows down peristalsis. It slows down the GI tract. That's why the patient is at risk for constipation. Patient who's taking morphine, they need to be drinking lots of fluids, eating foods high in fiber. They need to ambulate. We need them moving about. Why? Because peristalsis slows down. They're going to be at risk for constipation. We don't want that. And last, where it says I may experience some nausea when I start taking morphine. Yes, that is a common side effect. Now, that will wear off, but at the beginning, they may experience that. So you're going to teach them that. But what's wrong is them saying that I can take an extra dose. No, they need to take it as ordered. We don't want them to OD. We don't want them to overdose on morphine. By the way, if your patient did get too much morphine, they OD'd on morphine, what would you expect to be given this patient? Anyone? Thank you. Naloxone, Narcan. Very good. Select all that applies. Which factors would you recognize as contributing to an increased risk of developing chronic pain? Here are your options: advanced age, being female gender, regular physical exercise, having a history of depression, low socioeconomic status, smoking. Select all that apply. Which factors would you recognize as a contributing, factor to increased risk for developing chronic pain? Factors that increase the risk of developing chronic pain. What do you think those are? Guys, before I end the live, please don't let me forget to put the grip sock in the book bag, please, because I will. Okay, so let's talk about this. Advanced age, yes, that's the risk factor. Female gender, yes, risk factor. Regular physical exercise, no. Regular physical exercise that actually decreases the risk of developing chronic pain. When you're exercising regularly, it releases endorphins, make you feel good, make you feel better, right? So no on regular exercises. History of depression, absolutely. Low socioeconomic status, absolutely. Smoking, absolutely. Which of the following instructions would you include when you're educating a patient about extended release opioids? Here are your options. You can crush and mix it with food if you have trouble swallowing. Take this medication only when you feel pain is starting to increase. Take this medication even if you're not currently in pain, or you can safely take it without consulting your healthcare provider. Wow. Most of you guys chose take this medication on. First of all, first of all, first of all, that word only should have been your red flag to make you know that was not the answer. Okay? Stay away. If you don't know what the answer is and you see any answer choice that includes only, always, never, do not choose that as your answer. Usually that's not your correct answer unless the question's asking you for a wrong answer choice, right? So in this question, they're asking about extended release opioids. What do we know about extended release opioids? We know that extended release opioids are for what? Chronic pain. Okay. 15 of you guys chose take this medication only when you feel the pain is starting to increase. Absolutely not. You're taking this long term. It's for chronic pain. Even if you don't feel that pain actively right now, you're still going to take it, because guess what? If you wait until the pain starts to increase, by the time you take that medication, it actually starts to work in your body, you're going to be at a level 20 out of 1 through 10. Okay. Only 8 of you guys chose the correct answer, which is take this daily. Why? Because it's for chronic pain. Take it daily, even if you are not currently in pain. Hello, look at the kind of drug we're talking about, extended release, duh. Everything else is wrong. You can crush and mix it with food. I'm happy only 3 of you guys chose that. You know you can't. False. Um, and you can safely take it without consulting your healthcare provider. I cannot believe 5 of you guys chose that. You cannot safely take anything without consulting your healthcare provider. And guys, that includes over-the-counter medications and herbs. Anything growing off the tree in your backyard, even though it's natural, you still have to check with your healthcare provider. Why? Because a lot of these natural resources, these herbs, they what's the word I'm looking for? They counteract medications that you may be on. Okay? Yes, thank you. Interact. Thank you. I said counteract. You know what I meant. They interact with other drugs. So, herbal medicines, herbs, over-the-counter medications, you still have to check with your healthcare provider. Which statement by the patient indicates a need for further teaching about PCAs, which are patient-controlled analgesias? Okay. I can press the button whenever I feel pain for medication. The PCA pump is set to prevent me from taking too much medication. It's okay for my family to press the button if I'm asleep and in pain. I'll let the nurse know if my pain is not controlled, even with the PCA. Which one requires a need for further teaching? Very good. It's okay for my family to press a button if I'm sleeping and in pain. Let me tell you something. If the pain is that bad, you're going to wake up from sleep and press the button yourself. So one of the important teaching to, PCAs, if it's a child, maybe they've got sickle cell, or even if it's an adult, you're going to teach a patient, you're going to teach the caregiver, you're going to teach the family members that come to visit. Only the patient should press the button. Because because what happens is the patient will be sleeping and they'll moan, they'll be like, and the family member, oh my gosh, they're in pain, and they'll press the button for the patient. No, if the pain was bad enough, they would open their eyes or just press the button themselves, right? So no one should be pressing that button themselves. Everything else is correct. I can press the button whenever I feel pain for medication. Yes, because you're only going to get a prescribed amount of medication at a certain time, right? So if it's not within that window, you can press that button all you want. If you feel pain, press that button, but you're not going to get medication. Why? Because you can't overdose. You're not supposed to overdose with the PCA. So that's correct. Next, the PCA pump is said to prevent me from taking too much medication. Absolutely, because there's already a prescribed dose that can be given and no more than that. And there's a certain frequency. And last, I'll let the nurse know if my pain's not controlled. So you press the button and you're still feeling the pain, you need to let the nurse know. All of those are true. We were looking for a wrong answer choice, and that's why we chose it's okay for a family to press a button if I'm asleep and in pain. Absolutely not. All right, you're caring for a patient who reports severe pain 2 hours after receiving an opioid analgesic. What is going to be your priority action? Is it going to be to administer a higher dose of the prescribed opioid analgesic? Is it to reassess the patient's pain level and check for possible causes of increased pain? Is it to encourage the patient to try non pharmacological interventions such as deep breathing? Or is it to wait until the next scheduled dose to administer more pain medication? What are you guys going to do? What's the correct answer? Very good. Reassess the patient's pain level and check for possible causes of increased pain. Guys, it's a nursing process. So you go back to the question. It says you're caring for a patient who reports severe pain 2 hours after receiving opioid. So you gave the opioid, right? And after your nursing intervention, you have to evaluate. The evaluation is them saying that they're still in pain. It didn't work. So you're back at A, assess. Can you imagine? It's 2 hours after the patient just had, let's say, back surgery. And they're all like, oh, I'm in such pain. Oh, my back, my back. All you had to do was assess. You have the patient sit up a little and you look back there and they're sitting on a pin or a rat tooth comb, whatever. Something's poking their back. The pain is not even from the surgery. It's something poking them, but you wouldn't have known unless you did what? You assessed the patient. Why? Evidence-based practice has shown us that this medication that we gave for the pain should relieve the pain. It's 2 hours later, which means that there's been enough time for the medication to take effect and that pain's not relieved for something that evidence-based practice has shown us should be effective. What are we going to do? Assess, investigate, get information. Moving on. Are you guys doing on the live? Very good. Tolerance occurs with chronic exposure to a variety of drugs, including opioids. Is this true or is this false? Tolerance occurs with chronic exposure to a variety of drugs, including opioids. Is this true or is this false? True. Many drugs, including opioids, including narcotics. The more that you take the drug, the more that your body gets used to it, and you need a higher dose of that drug to feel the effect that you used to feel initially. Okay, that's called a tolerance. You got tolerance to that drug. This is very true. True or false? Heat therapy should not be used on areas being treated with radiation therapy that's bleeding or has been injured within the past 24 hours. Is this true or false? Heat therapy should not be used on areas treated with radiation that's bleeding or has been injured in the past 24 hours. True. Why is this true? Well, because radiation to that area, if it's bleeding or there's been any injury to that area, and you apply heat, what can you do? Cause more damage. True. True or false? When providing heat treatment, heat should be applied directly to the skin. Is this true or is this false? False. You always need a barrier, right? You apply heat directly to the skin. Same thing with cold, both. You always have to have a barrier, like a piece of cloth or something, because you will cause damage to the skin. and the tissues. Select all that apply. Which of the following findings would indicate that the patient is experiencing pain? Select all that apply. Increased heart rate, decreased respiratory rate, diaphoresis, facial grimacing, relaxed posture, moaning or groaning. What signs or symptoms would indicate that the patient's in pain? Because remember, guys, communication is not only verbal, right? Body language or objective measures such as vital signs can tell you if a patient's in pain. Or it can lead you to suspect that the patient's in pain, I should say. Increased heart rate, decreased respiratory rate, diaphoresis, facial grimacing, relaxed posture, moaning or groaning. Okay. First one, increased heart rate. Yep. That patient that's in pain, you can see the heart rate go up. You can see the respirations go up. You can see the blood pressure go up caused by increased pain. How about decreased respiratory rate? False. If anything, respiratory rate increase. How about diaphoresis? True. That patient's in pain. You can see them, they start sweating. Facial grimacing. Yep. They're making that face. They're in pain. Relaxed posture. I'm happy only one person chose relaxed posture. No. If the person's in pain, they may have a rigid posture. They may have a guarding posture depending on where the pain is, but they're definitely not going to be relaxed. If you're relaxed, you're not in pain. Last, let me not say if you're relaxed, you're not in pain, but a relaxed posture would not lead you to suspect that the patient's in pain. Thank you, Torsia. And last, moaning or crying. Yes, that's significant. That would lead you to think that your patient's in pain. And guys, that is it for pain. Let me know if you guys would like to see more content on pain, if you'd like a Kahoot or a Q&A like the ones I do on my YouTube channel, or maybe even a lecture. I think I've already posted a lecture on pain, but I can do a more in-depth lecture if that's something you guys are into. Grip socks. Thank you, Vero. Thank you. If that's something that you're into, let's see how you guys did.